Good afternoon, everybody. Today is Sunday, 26th of July, 2020. My name, as you know, is Dayo Adenawa. Welcome to my YouTube channel, Clear Vision Safety. My hashtags are hashtag Blind Safety Guy and hashtag Clear Vision Safety. So please remember to like. Remember to please share with your friends, subscribe to my channel, and of course, include in your notifications. So why am I before you today? I've had a chat with you this morning, and I found another topic which I felt was worth reviewing and talking about. And it's called What to Include in Your COVID-19 Risk Assessment. It's a HSE document, that being a Health and Safety Executive. It's a reasonably long document, so I'm not going to be able to read it line by line. I got it off the HSE website, www.hse.gov.uk, and then obviously the coronavirus pages. I think it's called Assets. I guess there's a minor challenge I've got. One being it's a long document. Two, it's a portable document format, that being PDF, fine. But in being able to read the document, as you know, I'm a blind person, I haven't found many landmarks I could use. So generally for me, I might decide that I want to find the headers on a page. So, which is fine. The main heading level 1 is what's included in my COVID-19 risk assessment. And some of the features on there talks about, which are the obvious ones when you do a risk assessment. You enter your company name, enter the date the assessment was carried out. And that's all the headers I've been able to find on in terms of landmarks. In terms of the links, that's fine. There's a link to the working safely in coronavirus during the coronavirus outbreak, which is fine. Core guidance on managing risk. Then it talks about Wales, England, Northern Ireland, etc. But that will not help me get around the pages. Realistically, what I would have loved were a range of headers which I could then use to navigate my way around this 15-page document. So as a blind person, I am needing to read it line by line. Unfortunately, I wouldn't be able to cover everything. I have read it already, absolutely all the document, but I'm now confined to needing to remember it. So please, HSE, remember this, it needs to be an accessible document for the likes of people like such as myself, relying on a screen reader technology. So I've already mentioned in terms of what to include in the COVID-19 risk assessment. It tells me and yourself, my listeners, that you need to include your company name. It talks about the date the assessment was carried out. As an employer, you must protect people from heading level 2 company name COVID assessment carried out by COVID. And then up there, someone which my George screen reader missed earlier, who carried out the assessment. I'm just going to reduce the volume so you're not hearing too much of these, and you can rely more on what I say or read out to you. So 46%, I'm just going to reduce it. 37%, that should do. Just not to cause too much distraction. So here we are. Heading level 1, what to include. Heading level 2, company name, COVID assessment. Heading level 2, data assessment. As an employer, you must protect people from harm. This includes taking reasonable steps to protect your workers and others from foreign actors. So what I quite like is the fact that it's reinforcing the fact that as an employer must protect people from harm. And it says it includes taking reasonable steps to protect your employees and others from risk to coronavirus, obviously COVID-19. I might have paraphrased there because I'm needing to remember quite a lot in that sentence there. So the things you must do. Remember, when in law or someone such as a regulator, in our case, the Health and Safety Executive, HSE, is saying that you must do something, this is what the law expects you to do. So let's have a look. So it says there are 4 items, and it says the first of the 4 items are identify what work activities or situations might cause transmission of the virus. So have you done that in your risk assessment? I have found in some situations, some that I have seen, I've actually completely left out what they do and broken down their work activities so they can determine what might actually lead to that risk of transmission. And so that is something I'd like to encourage, to ensure you're having a good look at what your work activities, and then from that, well, it says situations, which could then lead to that risk of transmission of coronavirus. So it says, think about who could be at risk. So potentially that would be your employees, that would be your suppliers, contractors, people who come to your facilities, those that might, for whatever reason, come across your facility. And one of the guidance the HSE had released or provided, and we will talk about guidance later, covers drivers who in the course of their work need to use your welfare facilities. So think about those as well, where it applies to you. That's a potential something that one might overlook there. So the third one, which is after think about who could be at risk. So the third one is, how likely is it that someone could be exposed? So item number 3. And then number 4, the fourth of them all, act to remove the activity or situation, and if this is not possible, control the risk. And as I say, I've read this document already, and some of the things I've found is where it talks about what are the controls that have been put in place. But then in addition, it talks about what steps have been taken to actually mitigate the risk. So for me, I think what it's saying to us is, yes, you might have want to put some control measures in place. That does not necessarily mean that risk has been fully eliminated. So where it hasn't, of those residual risks, what are you doing to address those as well? So keep that in mind, because I think some places where they have done a risk assessment and given a long list of control measures, yes, they may have put those measures in place, but they tend to forget there is the opportunity of the hazards or the risk still being present, because there is something called residual risk. So it does say here as well, this is now moving on, when completing your risk assessment, make sure you talk to your employees and their representatives. So keep that in mind that if you work in a unionized environment, so you might have a union rep, you need to be talking to them. But importantly, they are on the front line, so they will have some useful information they can share with you. So it does say to you, use this document to ensure you've covered what's needed. And this is something it says which is quite vital. You will also have to monitor to make sure that what you've put in place is working as expected. So that monitoring component is important. And it does say that there's more information on working safely during the coronavirus outbreak. So it means there's another document there that we can access. And it says there's an HSE core guidance on managing risk. So that's something else one could look for. It talks about the different rules on social distancing. That could be different depending on the country you're in. and goes through the different countries. And I talked about drivers earlier, so it mentions here about who could be armed and at least a range. It talks about drivers coming to your business, your own drivers going out of your business. Of course, they are going somewhere. So there is that risk that they could pick up or transmission there. So it's while keeping that in mind. And then there's guidance that they've told us they've released on cleaning, hand sanitizing. And it says to provide water, soap, and drying facilities. And you need to do that based on the number of workers. I guess you need to make sure you have sufficient facilities available to workers and those that will be using the facility. And think about your busy periods as well. For some places might have peak periods where there's a lot of traffic of people in their organization. And that will then lead on to, if there is going to be traffic of people, what routes are they using to access that building, as well in terms of entry and exit points, in terms of passageways. So you need to start thinking of controls you need to put in place to manage those as well. So precisely what it's saying there, just mentioned. Okay, then talks about it, use that to decide how many workstations are needed. Decide, I didn't say that, it didn't say use that to decide where the workstations will be located. Of course, depending on your workplace, it may not be possible to have a workstation at your front entrance, which is understandable, in which case you need to be thinking of providing hand sanitizers if you already have sufficient facilities, but provide hand sanitizers in situations where to do so or where it's required. It then talks about a legal duty. So there is a legal duty to provide washing, welfare facilities or washing facilities for visiting drivers, and then make sure you are talking to managers of facilities that your own drivers are visiting to ensure they are actually providing wash facilities for them. So you have that responsibility. I'll just go back and repeat that. There is a legal duty to provide welfare facilities, and you should talk to managers at facilities that your drivers are visiting. And it says put in place monitoring and supervision. Put signs up to remind people to wash their hands and remind them where and when to wash their hands. What they should also do is check their hands and skin for cracking. Of course, we all already understand that because of the ethanol, I believe, content of this sanitizers, it's going to crack your skin. So there are alcohol content, so at 60% plus and more frequent use, then there's that opportunity for that to happen. So think about how that will be addressed. Of course, what about your reporting system if there's a problem? You probably already have an existing method by which you report issues. So of course, this will just remind you that that needs to be done and utilized. And then also think about how that will be used. Potentially, you need to brief your employees on that, maybe give them training or refresher training on its use. There's quite a lot in this document. The challenge I have is where the HSE have not given me a way by which to reasonably get around this document. It means I'm not able to fly around it and quickly tell you what sort of information is in it. But this laid point to some extent in COVID and workers being at work and some places of work haven't resumed. My expectation is a lot of this is known to employers already, but more for those that do not know, at least I am refreshing their minds, giving them an indication of what they need to be looking for. So for example, this particular document, which is called What to Include in Your COVID-19 Risk Assessment. This is an HSE document. The good thing I like about it is in those places where it tells you what you must do. That is because that is probably already defined in law, so you are expected to do it. And things you should do. So that's why I like it. So that's good for the layperson, I would say. It talks about in this document as well about pinch points. And it explains what that means, where people cannot, I guess, that easily meet social distancing rules. So at least you can identify those. You know that you now need to think about identifying those areas. It talks about hard to clean areas. Talks about areas and surfaces that are frequently touched. Equipment where people touch the same surfaces. So obviously steps to be taken around that. I've got to say this document actually gives a long list and options of control measures as well. And many of these are costless measures. It's just, a lot of it is working around the issues to avoid that transmission. So communal areas where air movement might be less than normal. So obviously you have to think about how to resolve that. It's about leaving windows open, leaving doors open. So there's a lot more air circulation and movement. So the air is being refreshed a bit more regularly. Or do you need to think about some form of mechanical air circulation system that you need to install? Okay, so there's quite a lot here. I would encourage you to actually go to read it yourself, just so that this recording is not too long. You now know the document exists. It covers quite a lot. I imagine the HSE will update it regularly, but what I do hope is that it actually come across this recording and know to make it a lot more accessible to a blind person who uses screen reader technology, such as myself, and I use job access with speech, JAWS, which is quite commonplace. I need to be able to navigate this document easily. So please keep that in mind. Okay, thank you very much. I'm going to stop this now only because I cannot get down the pages as easily as I would have liked to. So it'll take a lot longer and that will make the recording not as worthwhile. But you now know what the document is called, so please look for it by searching in Google. Thank you.